This position is the axiolateral infero-superior projection. This is the trauma hip and pelvis, or the Danellis-Miller method. So I've got about a 40-inch SID. My collimation is approximately 10 by 12, maybe just a little bit longer there to go landscape with our image receptor. We're doing a right hip, so I've used the right marker that you can see here. And then we're going right across the table. So this is a little bit more difficult with a floor unit, but certainly you can see that the central ray is perpendicular to our image receptor. So we have flexed and elevated her unaffected leg, or her left leg, so that her thigh is as much outside of that collimated field as much as possible. One of the things you don't want to do for this position is you don't want to place their leg over here on the collimator box. That gets really hot, and that's not the best place to put that. So we want to make sure that leg is up and out of the way. We want to make sure the patient's laying flat so their ACEs are both equal to the table distance. We did use the hip localization method to find the femoral neck so that our image receptor is kind of there at the crease above the iliac crest, enough so that it's parallel to that femoral neck and perpendicular to the central ray. And we've used our image receptor holder. We're going to go ahead and internally rotate, if we can, the affected side about 15 to 20 degrees, unless there's a reason that we can't do that, like if we suspect a fracture. And so we're going across with a horizontal X-ray beam so that the central ray is perpendicular to the femoral neck and to the image receptor. We're going to have our patient suspend their respiration. So go ahead and take a breath in, hold your breath, and you can breathe. So a little bit difficult to shield on this particular image, though that's why you don't see a leg shield. If the patient were to have a known orthopedic hardware in the affected side, we would want to make sure that we expose that enough in order to show the distal portion of the prosthesis. And that is the cross-table lateral hip Danellis-Miller method.